Assalamu alaikum. My name is Dr. Dilip Kumar Khatri, and from today onwards, I will be teaching you the topic of nose, and different diseases of nose, and surgical procedures performed for the disease of nose. So let's start with the anatomy and physiology of nose. So for the purpose of description, the nose has been divided into two main parts: external nose and internal nose. External nose, as you can see, the most prominent structure on the face, the pyramidal shape, in the center of face, is the external nose. Regarding its description, we have to learn about its framework. The upper 1/3 of nose is actually bony, and the lower 2/3 is cartilaginous. As you can feel, if you feel your own nose, you would realize that the upper 1/3 is quite hard. The lower 2/3 is flexible. You can move it right and left, because the lower 2/3 is made of cartilage. Upper 1/3 is made of bone. Regarding the skin over the upper 1/3 is very loose and thin. You can pinch it, while as you come downward, the skin over the lower 2/3 of nose is quite thick and adherent to the underlying cartilage, and you cannot pinch it. The usefulness of this anatomy is, if, for example, you come across a case where there is trauma over the nose, you can put stitches over the upper 1/3 of nose, because the skin is easy to hold. But if there's a trauma for the lower 2/3 of nose, it is difficult to put stitches because you cannot grab the skin. Second, if there is a boil or inflammation over the lower 2/3, it is more painful, because boil does not have a space to expand, so it becomes more painful. You can see the osteocorticaneous framework in detail. See, the upper 1/3 is bony, made of nasal bone. Lower 2/3 made of cartilage. Upper lateral cartilage, lower lateral or alar cartilages. Then some smaller sesamoid cartilages are also there. Nose is covered with muscles. They help in moving the tip of nose, or help in opening or constricting the nasal apertures. You do not need to remember the name of all the muscles, but if you can remember, that would be more than wonderful. But you should know the functions of the muscles of nose. They mainly help in the opening, dilatation, or constriction of the nares. These muscles are supplied by the branch of facial nerve, as they are the part of facial expression. As we discussed, the skin upper 1/3 has a very freely mobile skin. The lower 2/3 has thick and adherent skin. Now, the internal nose, the nose which is covered by external nose, actually there are the cavities inside its skull, and the internal nose is divided into two right and left cavities by a meeting partition, that is nasal septum. See, in this figure, there's a partition in between the nasal cavity, which divides the nasal cavity into right and left. And you can see there are certain projections we are going to discuss. The nasal cavity, for the purpose of description, is again divided into nasal cavity proper and nasal vestibule. Nasal vestibule is actually the anterior part of nasal cavity, which is lined by skin. You can see in this figure, This portion of nasal cavity is lined by skin. This is nasal vestibule. Nasal vestibule starts anteriorly and extends up to the limit of this alar cartilage, up to this. So this portion is actually nasal vestibule, where uh, we can put our finger inside, and we most of the time we try to clean our nose. The finger uh, runs in the vestibule only. It cannot enter into the nasal cavity. And the part of nasal cavity is quite sensitive, and it cannot rollate our finger as well. So this portion of nasal cavity is nasal vestibule. It is lined by skin. Since there is skin, so there are hair follicles as well. This portion. The rest of portion is nasal cavity proper. So anterior portion is nasal vestibule, and the rest of the portion is nasal cavity proper. You can read anterior and inferior part of nasal cavity is lined by skin, and it contains hair follicles and glands. There's a structure called nasal wall. It lies between the nasal vestibule and the nasal cavity proper. This area is nasal vestibule. The importance of this is the internal wall, nasal wall. The importance of this wall is that we can constrict it, we can restrict the movement of anything that is going inside the nose. We can voluntarily narrow our nasal cavity, because this is again the narrowest part of nasal cavity, and we can modify its opening. Nasal cavity proper, for the purpose of description, is again divided into the lateral wall, medial wall, roof, and floor. Floor of nasal cavity, nasal cavity lateral wall. Now look at in this figure. This is the lateral wall of nasal cavity. You can see three prominent structures, three ridges, bony ridges here. These are actually the terminates. Bony projections at the lateral wall of nasal cavity are the terminates. There are three in number. The lower one is inferior turbinate, the middle one is middle turbinate, the upper one is superior turbinate. So there are three turbinates you can see, and you can see that inferior turbinate is the largest, running throughout the nasal cavity. The middle one is smaller than the inferior, and it runs to the posterior half of nasal cavity. The superior turbinate, it runs only the posterior 1/3 of nasal cavity. And the space between these terminates are called meatus. The space between the inferior or below the inferior turbinate is inferior meatus. The space between the middle and the inferior turbinate is middle meatus. The space between the superior turbinate and middle turbinate is superior meatus. And the space between the roof of nose and superior turbinate is sphenoethmoidal regions. So there is the importance of these turbinates and the meatuses as well. You can have a look on another view of these turbinates. See, if you look at the nose from front, these turbinates look like this. This one is inferior turbinate, this one is middle, and this one is superior. On clinical examination in the OPD, we can only visualize the inferior turbinate because it is the anterior-most. See, here we can visualize the inferior turbinate if we examine the patient in OPD with the help of nasal speculum. This middle turbinate and superior turbinate cannot be visualized in OPD because we need to use endoscope. If the patient is in anesthesia, then we can look at these terminates. Inferior turbinate is a separate bone, and as we discussed, it runs throughout the nasal cavity. And the space between the inferior turbinate and the floor of nose is inferior meatus. The important thing to discuss here is it provides access to the lower end of nasolacrimal duct. Nasolacrimal duct is a duct which connects the lacrimal sac to the nasal cavity. lacrimal sac actually collects tears from the eye. So inferior meatus give access to nasolacrimal duct. If any of you have to ask any question, they can text me in the chat box. I will answer those questions after the presentation. Middle trabinate, as I discussed, the space between the middle trabinate and the inferior trabinate, the space between the inferior and middle trabinate is middle meatus. Middle trabinate gives access to the sinuses, maxillary sinus, frontal sinus, and anterior ethmoid air cells. These are the paranasal sinuses which are located around the nasal cavity. They drain into this meatus, middle meatus. Superior trabinate, as I told you, it runs only up to the posterior one-third nasal cavity. The space between the superior trabinate and the middle trabinate is superior meatus, and the superior meatus gives access to the sphenoid sinus and posterior ethmoid air cells. The space between the roof of nose and superior trabinate, this space is sphenoethmoidal recess. Now I'm repeating. This is inferior trabinate, this is middle trabinate, and this is superior trabinate. This space is inferior meatus, this space is middle meatus, this space is superior meatus, and this space is sphenoethmoidal recess. This meatus gives access to nasolacrimal duct. You can see it's coming here. This space gives access to the opening of maxillary sinus, anterior ethmoid cells, and frontal sinus. This space, which is the superior meatus, it gives access to the posterior ethmoidal air cells and sphenoid sinus. Roof of nasal cavity is somewhat irregular. It is sloping anteriorly in the anterior part and sloping. See, this is the roof of nasal cavity. Anteriorly, it is sloping anteriorly, and posteriorly, it is also sloping, and this middle part is somewhat horizontal. Anterior sloping is because of this nasal bone. Posterior sloping is because of this sphenoid bone, and this horizontal part is actually the cribriform plate. Cribriform plate is an important structure as it gives access to the olfactory nerves, which are responsible for olfaction. Floor of nasal cavity is formed by the hard palate. The hard palate is actually the roof of oral cavity, but it is the floor of nasal cavity. Hard palate is formed by the palatine process of maxillary bone and maxillary process of palatine. The floor of nasal cavity is straight and simple. It is formed by palate. Regarding the mucous membrane or the lining of internal nose, mucous membrane of nasal cavity is of three types. Two types: olfactory mucosa and respiratory mucosa. The vestibule is lined by skin. Vestibule is lined by skin and it contains sebaceous glands and hair follicles. But the nasal cavity is lined by olfactory mucosa and respiratory mucosa. Olfactory mucosa is confined to the upper one-third only. Upper one-third of lateral wall, upper one-third of medial wall, and the roof of nasal cavity is also lined by olfactory mucosa, olfactory region. Why do we call it olfactory? Because it possesses the ends of olfactory nerves. There are olfactory receptors which are responsible for a sense of smell. So the sense of smell is detected by olfactory mucosa and it is confined to the upper one-third of nasal cavity. The rest of the two-thirds of nasal cavity is respiratory mucosa. Respiratory mucosa is ciliated pseudostratified columnar epithelium, and it has also very important function. There are multiple goblet cells in the respiratory mucosa, which increases the secretions at the time of need. And we'll discuss this later. It contains plenty of goblet cells, and the lining is actually pseudo-stratified ciliated columnar epithelium. The nerve supply of nasal cavity is also very important. It has three kinds of nerve supply: olfactory nerves, which are responsible for the sense of smell; the nerve of common sensation, which actually detects the sense of touch, pain, pressure, temperature; and the autonomic nerves. Autonomic nerves actually control the secretions in the nasal cavity. The need when there's a need of high secretions, then the nerves are stimulated and it causes excessive secretions in the goblet cells of nasal mucosa. We'll discuss one by one. Olfactory nerve is the first cranial nerve. It has about 10 to 20 nerves, which has multiple endings in the cranial plate, which is the roof of nose. The general sensation is because of anterior and the branch of sphenopalatine ganglion and infraorbital. These nerves actually carry the general sensation. The importance of these nerves is, for example, if you are performing any surgery under local anesthesia, then you should know the nerve supply, this supply of general sensation, so that you can block those nerves. Now see, the most of two-thirds of nasal cavity is supplied by the branch of sphenopalatine ganglion. So you can block this sphenopalatine ganglion by putting a lignocaine cotton swab over the posterior extremity of middle trapeze, because at that site, this nerve enters into the nasal cavity, and if you put a local anesthetic at this particular site, you can block the sensation of two-thirds of nasal cavity. Likewise, we know the upper one-third and the anterior part of nasal cavity is supplied by anterior middle nerves. You can, if you want to block that nerve, you have to place a lignocaine cotton the nasal cavity, but the nerve enters the superior part of nasal cavity. Autonomic nerves. Autonomic nerves are very important, and they control the secretions of glands in the nasal cavity. The goblet or mucus producing glands, they are controlled by autonomic nerves. It has parasympathetic and sympathetic component. Parasympathetic nerves actually increase the secretions of these glands, and sympathetic stimulation actually decreases the secretions of these glands. The important nerve is median nerve, which contains the fibers of both parasympathetic and sympathetic. Parasympathetic fibers are carried by greater superficial petrosal nerve, the branch of facial nerve, while the sympathetic fibers are carried by deep petrosal nerve, which is coming from cervical sympathetic chain. So these both nerves combine to make a single nerve that is called median nerve. Median nerve actually carries the fibers of autonomic nervous system. Discuss the functions of nose. Now, what are the functions of nose? Number one, breathing. Of course, nose provides a passage for air to go into the lungs. It's a pathway of breathing. But nose is not confined for just this single function, because breathing we can do with mouth, we can breathe with mouth, but nose has some more specialized functions which help us in many ways. Olfaction, the sense of smell is detected by the nose, because as we discussed earlier, the upper one-third of the nasal cavity is lined by olfactory mucosa. It has certain nerve endings which are connected to the olfactory nerve, and the sense of smell is detected by those nerves. Air conditioning of air means the air which is held by us is actually modified. The temperature of the air is brought to the normal world temperature. For example, if you are in If we are in an environment where there's a very cold air and we are inhaling the cold air, the nose, the nasal cavity is designed in such a way that it can bring that lower temperature up to the body temperature within 1/4 of a second. Likewise, if we are inhaling very warm or hot air, the nose can bring that high temperature air up again to the body temperature. Secondly, it humidifies the air. It humidifies the air up to the 75%. Before going to the lung, air is humidified. Protection of airway. The air may contain many pollutants, many particles, so it filtrates the air. And nose also protect us by filtering the pathogens, the bacteria, the pollens. They are also filtrated in the nasal cavity before they reach into the lungs. Nose also provides a passage for the drainage of perineal senses. Drainage of perineal senses. Senses which are around the nasal cavity, they are drained to the nose, and the perineal senses are lined by, as we know, they are lined by the mucosa. They need ventilation, so the ventilation is also provided by this nose. Nasal resistance. This one is also important. We'll discuss it later. And vocal resonance is also one function of nose, and there are certain reflexes which are because of this nasal cavity. We will discuss it shortly. Breathing is a natural pathway of breathing, as we know, and because of this nose, we can eat and breathe simultaneously. And breathing through mouth is actually learned, but the breathing through nose is naturally. The importance of this point is the newborn infants, they do not know how to breathe through mouth. If for any reason, if their nose are blocked, they may develop respiratory distress. Olfaction, as we can see, the upper 1/3 of nasal cavity is lined by olfactory mucosa. There are certain nerves. This is the olfactory bulb, part of olfaction, olfactory pathway. So there are nerve endings. When air goes inside, reaches there, we sense the smell of the sense of smell. We sense the sense of smell. Can you hear me? Or if you have any query or any problem, you can text me. The chat box is open and you can text me. Air conditioning of air is performed by controlling the temperature of air. Either it's very warm or very cold. Nasal cavity is designed to bring the temperature to the normal level, normal body temperature, that is 37 degrees centigrade. And nasal cavity is also designed to humidify the inhaled air. For example, if the air is not humidified, it will result in infection of the respiratory tract. Protection of airway is done in one of these three ways. Filtration, of course, it filtrates. The larger particles are filtrated for the vestibule because it contains hair follicles, hairs. So hairs can filter the larger particles. And then if there are smaller particles, they are entrapped in the mucosa, which is very sticky. So the smaller particles are trapped in the mucosa. The particles which are very smaller, about less than half micrometer, they are not filtered and they can go into the lungs. Nasal mucosa also contains the enzymes and immunoglobulins that fights against the antigens or bacteria or pathogens which are inhaled in the air. The enzymes and immunoglobulins help us in protecting us against those pathogens. And then there is a sneezing reflex. If anything is gone stuck in the nasal cavity, we develop a sneezing, and because of that sneezing, the particle is thrown out of the nasal cavity. Ventilation and drainage of nasal sinuses is done through this nasal cavity. When we inhale the air, there's a negative pressure in the nasal cavity that actually sucks the air from the paranasal sinuses. And when we exhale, there's a positive pressure in the nasal cavity, and this positive pressure causes the air to be pushed into the paranasal sinuses. This way, the ventilation of sinuses is done. See this figure? This is how the air goes in. This is how the air goes out. When it goes out, there is the air is reflected, a kind like AD currents. We call it AD currents. Because of these AD currents, the air is ventilated from the sinuses. Nasal resistance, as we read this heading in the previous slide, nasal resistance has also very important importance in the ventilation. When we exhale the air comes across a resistance in the nasal cavity. Because of this resistance, the pressure is created, a positive pressure is created in the lungs. And because of this positive pressure, the alveoli expand. They do not collapse. This is a very important function of nasal cavity. Nasal cavity also helps in making the resonance of certain sounds. For example, in our normal conversation, if you want to pronounce some sounds like M or N, for these sounds, the air has to come out from nasal cavity. And for example, if our nose is blocked because of any reason, we will not be able to produce sounds of M, N, or N, and they will be said like B, D, or G. Hope you understand this. So for production of certain sounds, the nasal cavity has to be opened, has to be patent. Nasal reflexes, gustatory reflex. According to this reflex, when we smell or when we feel the odor of any food, the secretions in the oral cavity, the stomach, they starts increasing because of this gustatory reflex. And nasopharyngeal reflex means if there is any constriction in the nasal cavity, automatically there is constriction in the bronchus as well. Maybe it is because of any protective response, but it is a reflex that whenever there is a constriction in the nasal cavity because of any foreign body or a nasal packing, the patient also develops constriction of the bronchus. I think this is the end of this presentation. So we can revise rapidly if you want, or if you have any question, you can ask me. देखिए नोज को हमने दो हिस्सों में डिवाइड कर लिया, एक्सटर्नल नोज और इंटरनल नोज। एक्सटर्नल नोज वो जो हमें नजर आता है चेहरे पे, ये जो पैरामिडल स्ट्रक्चर है ये असल में एक्सटर्नल नोज है। ये बोन का और कार्टिलेज दोनों का बना होता है। इसका जो ऊपर वाला 1/3 है वो बोन का बना हुआ है, जो लोअर 2/3 है वो कार्टिलेज का बना हुआ है। दूसरी बात ये कि इसकी जो स्किन है यहाँ पर ऊपर 1/3 पे स्किन जो ना वो थिन होती है और लेक्स होती है ना, मतलब चिपकी हुई नहीं होती है, जबकि लोअर 2/3 पे जो स्किन होती है वो थिक होती है और चिपकी होती है। नोज के ऊपर काफी मसल्स होते हैं जिनके नाम ये लिखे हुए हैं, अगर आप याद कर सकती हैं तो करें। इनका काम होता है कि नोज को थोड़ा बहुत टिप को मूव करना, या फिर जो ओपनिंग होती है नोज की उसको कंस्ट्रिक्ट करना हो, डायरेक्ट करना हो, तो इन मसल्स के थ्रू हो सकती है। इसके नाम डिस्कस कर चुके हैं। अगर नोज का इंटरनल नोज को देखें तो दो कैविटीज है बड़ी सी, राइट एंड लेफ्ट, और इन कैविटीज के अंदर भी काफी स्ट्रक्चर्स इंपॉर्टेंट हैं, तो हम उसको पहले डिवाइड करते हैं कैविटी को। ये वेस्टिबुल, नेजल वेस्टिबुल जो है ना, नाक का जो बिल्कुल इंटीरियर पोर्शन है इसे कहते हैं, और इसकी इंपॉर्टेंस ये है कि इसमें स्किन होती है, इंटीरियर पार्ट जो है यहाँ पर, जिससे वेस्टिबुल कहते हैं, इट इज लाइन बाय स्किन। हाँ तो वैसे भी, लेकिन अंदर से भी इसमें स्किन ही होती है, इसीलिए जो हम अपनी फिंगर को भी इसमें मूव कर सकते हैं और हमें कोई परेशानी भी नहीं होती है। लेकिन जो इसका पोस्टीरियर पार्ट है इसमें म्यूकोजा होता है, ये सारा म्यूकोजा होता है, लेकिन यहाँ पे स्किन होती है। अब स्किन होती है तो स्किन में हेयर फॉलिकल्स भी होती हैं, हेयर फॉलिकल्स हैं, और हेयर्स भी होती हैं वेस्टिबुल में, जबकि म्यूकोजा में हेयर फॉलिकल्स नहीं हो सकते, क्योंकि हेयर फॉलिकल्स कैन ओनली बी इन द स्किन। म्यूकोजा डज नॉट हैव हेयर फॉलिकल्स and hence no hairs in the mucosa. नेजल वॉल्व का ये मतलब है कि जो पोर्शन है, ये वाला हिस्सा जो है जहाँ पर ये कार्टिलेज खत्म हो रहा है और ये वाला कार्टिलेज यहाँ से मिल रहा है, इस जगह पे कंस्ट्रक्शन होती है, मतलब रुकावट या नैरोइंग होती है अंदर से, और इस हिस्से को नेजल वॉल्व कहा जाता है। आप लोगों में से वो स्टूडेंट्स जिन्होंने वार्ड में पोस्टिंग की है ना, तो उनको हमने बताया था कॉर्टल्स टेस्ट। वो टेस्ट जिसमें हम चीख को थोड़ा सा डिटेक्ट करके पेशेंट से पूछते हैं कि आपको आवाज आ रही है नहीं आ रही, तो एक्चुअली वो हम इस रीजन को ही थोड़ा सा खोलने की कोशिश करते हैं, नेजल वॉल्व को। अगर किसी पेशेंट को नेजल वॉल्व का इश्यू है, जैसे नैरो है बहुत, या डीएनएस है एट्री पार्ट में, तो उसमें कॉर्टल टेस्ट पॉजिटिव आ जाता है। फिर नेजल कैविटी में रूफ है, लेटरल वॉल है, मीडियल वॉल है, फ्लोर है। देखिए फ्लोर, नेजल कैविटी का फ्लोर हार्ड प्लेट से बना हुआ है, और रूफ इसकी देखें एंटीरियरली नेजल बोन से बना हुआ है, पोस्टीरियरली स्फिनाइड बोन से बना हुआ है, सुपीरियरली क्रीविफॉर्म प्लेट है। लेटरल वॉल जो है इसमें देखिए तीन प्रोजेक्शन है, इनको टर्मिनेट्स कहते हैं, सुपीरियर टर्मिनेट, मिड टर्मिनेट, इंफीरियर टर्मिनेट, और हर टर्मिनेट के नीचे जो स्पेस है उसको मीरस कहते हैं। जो टर्मिनेट है उनका नाम उस हिसाब से, जैसे सुपीरियर टर्मिनेट के नीचे जो स्पेस है उसे सुपीरियर मीरस कहते हैं, मिडिल के नीचे इसको मिडिल मीरस कहते हैं, इंफीरियर के नीचे जो स्पेस है उसे इंफीरियर मीरस कहते हैं। एक स्पेस जो कि सुपीरियर से ऊपर है और रूफ के बीच में, इसे हम कोई मीटस नहीं कहते, इसका नाम है स्फिनोइथमेटल रिसेस। स्फिनोइथमेटल रिसेस कहते हैं इसको। जो मीटस से इसकी इंपॉर्टेंस है, इंफीरियर मीटस में नेजोलैक्रिमल डक्ट ओपन होती है, देखिए नेजोलैक्रिमल डक्ट जो है ना वो इंफीरियर मीटस में ओपन होती है, जबकि मिडिल मीटस में मैक्सिलरी साइनस, फ्रंटल साइनस, इथमाइड साइनस की ओपनिंग होती है मिडिल मीटस में। सुपीरियर मीटस में होती है स्फिनाइड साइनस और पोस्ट इथमाइड साइनस की ओपनिंग, इस जगह पर। प्रूफ जैसा कि मैंने कहा, यहाँ पर ओल्फैक्टरी म्यूकोजा होता है जो कि सेंस ऑफ स्मेल को डिटेक्ट करता है। लाइनिंग जो है इंटरनल नोज की, उसमें तो वेस्टिब्यूल है जो हमने डिस्कस किया था, एंट्री पार्ट ऑफ नजल कैविटी है, व्हिच इज लाइन्ड बाय स्किन। जो रेस्ट ऑफ द नजल कैविटी है उसकी लाइनिंग में भी दो किस्म के म्यूकोजा होते हैं। तो रेस्पिरेटरी म्यूकोजा होता है व्हिच इज रिस्पांसिबल फॉर मल्टीपल फंक्शंस ऑफ नजल कैविटी, एयर कंडीशनिंग, फिल्ट्रेशन, प्रोटेक्शन। जो अपर वन थर्ड होता है वहां पर ऑल्फैक्टरी म्यूकोजा होता है जो कि रिस्पांसिबल होता है सेंस ऑफ स्मेल के लिए। नर्व सप्लाई जो होती है नजल कैविटी की, वो भी तीन तरह की होती है। एक तो ऑल्फैक्टरी नर्व्स होती हैं जो कि सेंस ऑफ स्मेल को डिटेक्ट करती हैं। दूसरी नर्व्स ऑफ कॉमन सेंसेशन जो कि टच वगैरह या पेन को डिटेक्ट करती हैं। तीसरा ऑटोनोमिक नर्व्स होती हैं जो एक्चुअली सीक्रेशंस को कंट्रोल करती हैं, जो नजल कैविटी में सीक्रेशंस बढ़नी है कम होनी है। पैरासिम्पैथेटिक सिस्टम अगर एक्टिवेट होता है तो वो सीक्रेशंस को बढ़ा देता है, अगर सिंपैथेटिक सिस्टम एक्टिवेट होता है तो वो सीक्रेशंस को कम कर देता है। Olfactory nerve is the first cranial nerve. It has 12, 10 to 12 nerve endings in the cutiform plate, which is actually the roof of nasal cavity. जो जनरल सेंसेशन की नर्व्स हैं उसमें तीन तरह की नर्व्स हैं। एंटीरियर माइडल जो कि सप्लाई करती है एंटीरियर सुपरफिशियल nasal cavity. Sphenopalatine ganglion supplies the posterior two-third of nasal cavity, and the infraorbital nerves supplies the vestibule of nasal cavity. अगर हम चाह रहे हैं कि हम पोस्टीरियर टू थर्ड को ब्लॉक करें तो हम जानते हैं कि वो स्फीनोपेलेटाइन गैंग्लियन से नर्व्स आ रही होती है। स्फीनोपेलेटाइन फोरामेन जहाँ से ये नर्व आ रही होती है वहाँ पर अगर कोई लोकल कॉटन अगर रख दें तो ये नर्व सेंसेशन ब्लॉक हो जाएगी उसकी। अगर हम कोई सर्जिकल प्रोसीजर करना चाह रहे हैं तो हम ब्लॉक करके कर सकते हैं विदाउट गिविंग जनरल एनेस्थीसिया टू द पेशेंट। इसी तरह अगर हम चाह रहे हैं कोई प्रोसीजर जो कि एंटीरियर या सुपीरियर पार्ट ऑफ द कैविटी में होना चाहिए तो उसको ब्लॉक करने के लिए हम बैक को नेजल कैविटी के ऊपर रखेंगे जहाँ पर नेजल बोन्स स्टार्ट होती हैं, क्योंकि हम जानते हैं कि the upper portion of the cavity is supplied by anterior medullary nerves, and these nerves enter the nasal cavity at the site where nasal bones are connected with the frontal bone. Autonomic nerves, as we discussed, responsible for the secretions of nasal cavity. Functions: breathing है, olfaction है, air conditioning है। air conditioning मतलब कि warm या cool air को करनी होती है और humidify करनी होती है। This function is called air conditioning. Protection of airway by filtration, by antibodies, by immunoglobulins. Ventilation of the sinuses and their drainage as well. Nasal resistance helps in expansion of the alveoli when we are breathing out. When we are breathing out, because of resistance in the nasal cavity, the alveoli tends to expand and do not collapse. Vocal resonance for pronunciation of certain sounds, the nasal cavity has to be patent, like M, N, or ing. To produce these sounds, nasal cavity should be open. And reflexes like nasopharyngeal or gustatory reflex. ठीक है, this is the end of this presentation और हम इसको खत्म करें। अगर आपको कोई क्वेश्चन पूछना है तो पूछ सकते हैं, वरना फिर मैं ये क्लोज करूँ। अच्छा, किसी ने पूछा है कि एडी इफेक्ट क्या होता है। एडी इफेक्ट का मतलब ये होता है कि जब हम सांस बाहर निकालते हैं, जब हम एक्सहेल कर रहे होते हैं, तो जो एयर का करंट होता है ना वो डायरेक्टली नोज से बाहर नहीं आता, नेजल कैविटी में पहुंचकर कुछ एयर जो ना वो रिफ्लेक्ट हो जाती है और वो जो घूम घूम जिस तरह घूमती है इस तरह घूमने लगती है। बिकॉज ऑफ दिस एडी इफेक्ट एयर जो है ना वो साइनसेस में भी एंटर हो जाती है और वहाँ जो पुरानी एयर है वो बाहर आ जाती है। सो इससे कहते हैं एडी इफेक्ट। एडी इफेक्ट इस तरह नहीं, हवा जो चलती है ना घूम गोल गोल जो हवा चलती है, एडी असल में वहां से लफ्ज उठाया गया है। तो नेजल कैविटी के अंदर भी कुछ ऐसा इफेक्ट बन जाता है जब हम बाहर सांस निकालते हैं। और कोई क्वेश्चन पूछना चाह रहे हैं? ठीक है, तो अब हम मीटिंग खत्म करते हैं। सही है, थैंक यू वेरी मच। नेक्स्ट जो ना हम डिजीज ऑफ एक्सटर्नल नोज पढ़ेंगे। ठीक है, तो आपको प्रिपेयर हो गया। थैंक यू।